I am Dr. Santosh Jha. Today's topic is Fallots, and you know about the Fallots triad, Fallots tetrology, Pentology. So, how will you retain it? By the trick. So, first of all, start with Fallots triad. How will you retain Fallots triad, tetralogy, and Pentology? If you draw a diagram like that, it is hard. This is superior vena cava, and it is right atrium, left atrium, right ventricle, left ventricle. This is pulmonary artery. Here it is aorta, and it is pulmonary vein. Okay, first of all, triad. In that you have to draw here. First, there is pulmonary stenosis, so you can easily retain it, defect in the pulmonary artery. Pulmonary stenosis takes place here. Okay, second one is atrial septal defect, ASD, that means defect are there. Third one is right ventricular hypertrophy, that means it becomes bigger. Okay, so you can easily retain it by you draw a diagram like that. That means atrial septal defect, right ventricular hypertrophy, and pulmonary stenosis. Okay, second one diagram is here. This is heart. This is imaginary diagram, so you can retain it like that. Okay, then here tetralogy of Fallot, that means defect in ventricular septal defect, pulmonary stenosis, overriding or dextroposed aorta here. Okay, and right ventricular hypertrophy, that means lower part. Okay, you can draw this like that and retain like that, so can you remember in for longer time. Okay, then what is the next is Pentology of Fallot. Again, draw diagram like that. And then here again ventricular septal defect, pulmonary stenosis, overriding of aorta, and right ventricular hypertrophy, and here ASD, atrial septal defect here. So you can easily remember this like a triangle. You can draw it, but here you have to retain there is in the Fallots there is no hypertrophy of any other chamber other than right ventricle. Okay, or what is overriding or dextroposed aorta? Dextroposed aorta, that means if you draw a diagram of heart like that, here superior vena cava, inferior vena cava, here one is like that, and it is pulmonary trunk, valve is like that, and another one is here if you remember like that, and the aorta is here, aortic trunk, then overriding, that means here is ventricular septal defect, ventricular septal defect are there, and aorta are just above, these are just above the ventricular septal defect, known as overriding of aorta, also known as dextroposed aorta. Thanks for watching my video.